Colon cancer is cancer of the lower part of your digestive system. Most cases of colon cancer begin as small, non-cancerous clumps of cells called adenomatous polyps. Over time, some of these polyps become colon cancers. Polyps may be small and produce few, if any, symptoms.
Symptoms include diarrhea and constipation, a feeling that your bowel does not empty completely, blood in your stool, stools narrower than usual, frequent gas pains or cramps or feeling bloated or full, weight loss for no reason, fatigue, and nausea or vomiting.
Colon cancer is most common in people over the age of 50 and can be developed by someone without a family history of it. It's suggested that people 50 years and over get regular screenings to monitor their colon. People with colon cancer also have a higher risk of developing other types of cancer. There are 4 stages of colon cancer that can be divided into subgroups. Because cancer treatment continues to improve, the survival rates are increasing. Almost 3/4 of patients diagnosed with stage 1 colon cancer will survive past 5 years. In recent studies run by doctors, the data showed that the patients diagnosed with stage 3A cancer have almost the same survival rate as those with stage 1 cancer. The 73% chance is significantly higher than the statistics for those with stage 2 cancer or even stage 3B cancer. The reasons for this are still unclear.
The tumor gets bigger in each succeeding stage and it grows on the lining of the colon. This affects lymph nodes that are a part of the circulatory system. So when the tumor reaches stage 4, it can be detrimental to the entire body because cancerous cells spread to other organs via the lymph nodes.
There are several different treatment methods for colon cancer, such as surgery and radiation, but there are some alternatives like chemoprevention and genetic testing.
Chemoprevention uses natural or man-made chemicals to lower a person's risk of developing cancer. Researchers are testing if certain supplements, like calcium or vitamin D, can lower colorectal cancer risk. Some studies have found that people who take multivitamins with folic acid have a lower risk of colon cancer. Studies testing this are now underway. People also take drugs, known as statins, to lower cholesterol. These drugs may also lower the risk of polyps. This theory is also being tested.
Genetic tests have been developed that look at the activity of the genes in colon cancer tumors. These can be used to predict which patients have a higher risk of the cancer spreading. However, these haven't been proven to help predict who could benefit from chemo or other treatments. Tests are currently being run to solidify this thesis. While surgery and radiation are implemented after diagnosis, chemoprevention and genetic tests are used to treat the cancer before it's formed and lower someone's risk of developing it. Chemotherapy and chemoprevention are very similar in the way that they're administered. They also have very similar side effects such as hair loss, appetite loss, and fatigue, but there are many others. Surgery normally has a longer recovery time than the other treatments, but with developing technology, recovery time can be shortened.
With new treatments underway, there is hope that we can prevent colon cancer altogether. If chemoprevention and genetic tests work, then it's possible that doctors could destroy cancerous cells before a tumor is created in the body. Also, if we find the right genes that are involved in the production of cancerous colon cells, current patients can be treated and perhaps even cured. Also, with rising technology, researchers are sure to develop advanced medicine for colon cancer. In conclusion, there's a bright future for curing colon cancer.